Hi everyone, welcome to our channel. In this video, I am going to explain about the typhoid fever, what are the main reasons of typhoid and what symptoms the patient experience in typhoid, what are the laboratory tests are done to diagnose it and what the treatment plan doctors advise in typhoid patient and how we can prevent it. Before that, if you have not subscribed our channel, please do subscribe and also press the bell icon for regular updates and notifications. Coming to the topic, typhoid. Typhoid is a fever which was caused by a bacteria called Salmonella typhi. In the early 1900s, Mary Mellon, a cook, she was the one first infected with typhoid, and later she spread the infection to remaining 50 members in the household. From that time onwards, this fever is named as typhoid fever. And mainly, typhoid is an enteric fever because it mainly affects the intestinal system in humans. Coming to the reasons or the causes of typhoid, mainly typhoid is generally most commonly seen in months of June to October. Why? Because it's a rainy season and at that time most commonly there's no proper sanitation and no proper drainage system. Because of this, there are high chances of getting typhoid in June to October months. As well as typhoid is most commonly seen in people who does not maintain a proper hygiene. Like after going to the washroom they won't wash their hands, and people who won't wash the vegetables and directly from the market what they bought the vegetables they won't wash, and people who eat polluted food or unhygienic food on the outside, and people who drink polluted water. There are all the different causes of typhoid. Coming to the symptoms of typhoid, the person who got typhoid experience symptoms like dull headache, weakness, cough. Most commonly, the cough is dry cough, and fever. In typhoid, the fever pattern is step ladder pattern. That is, there is less fever in the morning, and the subsequent afternoon and evening there is high fever, that is subsequent rise in the fever, and by the end of the day the fever decreases. This is called a step ladder pattern, means continuously increasing throughout the day and in the end of the day it decreases. Similarly, in the first week there is a little fever. In the second and subsequent third week there is increase in the temperature. In the fourth week the temperature comes down. This is how the step ladder pattern is seen in typhoid. Other important thing in typhoid is, normally if a person gets fever his heart rate should be increased, but in case of typhoid there is decreased heart rate. Though there is high fever, there is decreased heart rate. This condition is called bradycardia. Decreased heart rate is condition is called as bradycardia. And person who infected with typhoid, children most commonly have diarrhea, and adults they experience constipation. However, it may vary. Some people may experience constipation, some people may experience diarrhea. And the typhoid patient also have a coated tongue. The white patch will be seen on the tongue, and tongue may also become dry. In the 7 to 10 days of typhoid, the person may also experience rose spots, that is pinkish reddish pink spots on the chest or on the back. If typhoid is not treated at the correct time, it may spread to the liver, spleen, and in severe cases, it may also cause intestinal ulcers. Ulcers in the intestine, there may probably cause intestinal bleeding. These are all the symptoms of typhoid. And to diagnose typhoid, what test doctor advise? Most commonly, blood test. In blood test, in the complete blood picture, in typhoid patient, most commonly have decreased white blood cells. This condition is called as leukopenia. Doctors also advise viral test. But be careful, based on the viral test report, don't confirm typhoid, because if a person also has some sort of viral infection or bacterial infection, viral test shows positive. So to confirm the typhoid fever, doctors may also advise other tests like blood culture, urine culture, stool examination, etc. Okay, only vital test don't confirm typhoid. Other tests also there like blood culture. Mainly blood culture is the diagnostic test for typhoid patient. And what is the treatment plan in typhoid patient? Earlier days, doctors used to advise chloramphenicol, which is to treat the typhoid. But these days, this bacteria, that is Salmonella typhi, has resistant to chloramphenicol. So, in the recent days, doctors are advising cephalosporin antibiotic, mainly cefixime, ceftriaxone, in the oral form or in injection. They are also advising azithromycin in some cases, but most commonly doctors are advising ceftriaxone injection or in the oral route to reduce the typhoid. Next, how we can prevent the typhoid? We can prevent typhoid by maintaining a proper personal hygiene, washing hands regularly, and drinking water which is boiled and cooled. Boiled water is better, and also washing the vegetables, the fruits before eating, and vaccination is also important to prevent the typhoid. This is all about the typhoid and its prevention. If you like the video, please share and subscribe our channel. Thank you.